tonight, in our midst, we have one of the industry leaders, right, to come and discuss with us. We have Mrs. Folasade Olufunke Lawal in our midst, and I'm sure that if you've been active on the pharma space, right, so you are going to have been seeing the name around victory drugs, and all. So basically, I'm going to be introducing Folasade to one of us, right, before she takes over the space, right. So Folasade is to 4 decades experience. Folasade, by God's grace, is the proprietor of Victory Drugs, founded May 6, 1989, with pragmatic involvement in numerous community programs aimed at preventive health and rational use of medicine. She champions health awareness campaigns on disease prevention and general awareness. A passion for preventive health bettered Victory Vaccine Clinic, a standalone vaccine clinic. Folasade's laudable practices as a community pharmacist has featured enviable professional strengths like ability to apply knowledge of community health principles and practice to the delivery of community health services, collaboration with other healthcare professionals in patient care, and research with publications in the international journals, ability to develop and execute appropriate educational plans and training materials. She has been instrumental to the production of some Association of Community Pharmacists of Nigeria, ACPN branded audiovisuals on health-related issues like hand washing and LD Heart, anchoring online health community groups such as Victory Diabetes Group, Victory Mothers Group, Victory Asthma Care Group, and Victory 50 Plus Group, where she engages other healthcare professionals to promote health of members of the various platforms. In addition, she's a member of many professional bodies, including the Clinical Pharmacist Association of Nigeria, CPAN, American College of Clinical Pharmacists, ACCP, International Society of Travel Medicine, National Society of Travel Medicine, West African Society for Parenteral and Enteral Nutrition, WASPEN, American Society for Parenteral and Enteral Nutrition, ASPEN, Society of Lifestyle Medicine of Nigeria, SOLON, Association of Public Health Pharmacist of Nigeria. Finally, she has also served her professional bodies meritoriously in various capacity and is currently the advisor, Drug Information Center, Association of Community Pharmacists of Nigeria. She also holds community posts such as treasurer, Family Impact Charitable Trust, and patroness of the Yo We Can, right? Join me to welcome on stage right tonight, or I will have to give her the spotlight. So I think we can do that, by maybe just sending a reaction from our hands as we welcome Folasade Olufunke Lawal, even as she takes the floor, right? So welcome once again, ma.
Thank you very much. I'm highly delighted to be in your midst, and I must say that this is very laudable and one of the needed platforms in pharmacy. So today we will be looking at pharmacy practice in Nigeria and how to fill the gaps. Kindly help me share the slides from your end. I'm unable to share from here.
Right, I'm on that. I'll do that now.
Okay. So as much as possible, I have tried to make this presentation practical. I have tried to address fundamental challenges, to look at the roots. I'm here to motivate us more than any other. And I believe that we all have a lot on the inside of us. We have a lot of potential. So my presentation is a little bit unusual. It might not be what you're expecting. I doubt it will be what you're expecting to see, but I am confident that we'll all have something to take home. Please put it on slideshow. or at least move it to the next slide for me so that we can go. So now I want us to just ruminate over these points. That's pharmacy and you. I don't know if you're all pharmacy students, but I believe that majority are. Now, does any of this describe or define you currently? Do you think, oh, I wasted my time studying pharmacy, or I'm wasting my time studying pharmacy? I don't think pharmacy has much to offer me. The pharmacy training is too rigorous for the benefits. I'm not sure I practice pharmacy after graduation. I need you to think through this. If any of this describes you, I believe that today there will be a change. Let's move on. Next slide. So if any of this describes you, then you are probably in one of these debilitating days. You are probably in a state of discouragement, disappointment, disillusionment, or depression. Let's go on. So today, my outline runs like this. I will briefly define my mission. Then we'll look at what pharmacy practice is. We'll look at the various fields of pharmacy practice. Then we'll take a case study and we'll look at some beautiful days, which we will see as distinguished days or distinguishing days. Then we identify the gaps there are and how do we fill the gaps. Next slide. So my mission, like I stated earlier, is to help you identify the gaps in pharmacy practice that you can fill. You're unique you because you're a unique person. Each of us is unique and we have different abilities. Then I'm here to motivate you to fill that gap. Next slide. So what is pharmacy practice? According to WHO 1996, pharmacy practice is the provision of medications and other healthcare products and services to help people and society make the best use of them, the best use of the medications, the best use of the healthcare products, the best use of the services. So that is the role, that is what pharmacy practice is. You want to provide medication, you are providing healthcare products, or providing health services in a way that will help the people and society to make the best use of them. I also went on to look at what good pharmacy practice is, and it says it's a practice of pharmacy that responds to the needs of the people who use. I'm sorry, I can't see the slides anymore. Hello? Hello?
Yes, ma, we can still hear you. I guess it's having problems with his network.
With his network. Okay.
Yes. I'll try to see if I can attend to that now.
Okay. Do I go on or do we want to wait so that you can follow seeing the slides? Do I go on?
Please, that's my network, please. Yeah, you can go on, please.
Okay, so we're looking at what good pharmacy practice is. And we said it's a practice of pharmacy that responds to the needs of the people who use the pharmacy services to provide optimal evidence-based care. So when you're able to respond to the people who need the pharmacy services and you are able to provide optimal evidence-based care, that is what we call good pharmacy practice. And that's a lot of responsibility on us as pharmacists. Next slide. So we'll briefly, very briefly, look at the fields of pharmacy practice. We have academia. You can be an academic pharmacist, you go into lecturing, and of course, with that, you will be involved in also some researches and what have you. The community space is wide. There's a lot to community pharmacy right now. It's not what it used to be in our own days when we started, when the focus was majorly on the drugs. Now there's paradigm shift. We have included the patients in our focus. We've not looked away from the medications or drugs, but we have decided to look at enlarge our scope to encompass the patients, the people who need the medications, and how does this medication affect them? How can we prevent them from using the medications? So many thoughts. So community pharmacy practice has really expanded. And you could be in regulatory like NAFDAC, NDLEA, and what have you, or Pharmacists Council of Nigeria, where you are regulating either the practice or you are regulating products. You still a field of pharmacy practice. We also have hospital pharmacists, and it will interest you to know that hospital pharmacy is now so wide. You could specialize in certain conditions. You could be a geriatric pharmacist, you could be a pediatric pharmacist, you could specialize in renal care, you could specialize in managing asthma, different conditions. So we have oncology pharmacy. So hospital pharmacy is so wide now and encompassing. Then we have the industry, as we know, where drugs are manufactured. We have people that import drugs into the country, still part of the industry. And it's also a big space for pharmacy practice. Or you could be in the military. Some pharmacists are in the military, and some are devoted exclusively to research and be in the wholesale space. You could also be in journalism. Today, we know pharma news making waves out there in pharmacy journalism, and more are springing up. Then you could be in space, or you could also decide to go for data management, or you could develop software. Pharmacists are developing software. I'm sure this is not exhaustive, but I have brought this out for us to see. So there's a lot of space in the pharmacy practice. Next slide. So my question to you this evening, and I want you to think about it properly, deeply. Why are you a pharmacist, or why do you want to be a pharmacist? Some years ago, interestingly, I had some students that wanted to do IT with me, and there was this young guy. I'm sure his perception has changed now. And then I said to him, son, why do you want to be a pharmacist? He said, to make money. I said, then you're in the wrong profession. You shouldn't be in pharmacy to make money. And because of that, I decided to take him on to see that there's more to pharmacy than making money. So I said, come, let's walk. Let me have you. Let's move on. Next slide, please.
It's on the next slide already. I don't know why it's not this.
Okay, so that's a poor mindset, a mindset that is about me. So today we want to look at, can we change that mindset? You need to do away with the debilitating Ds. Did you skip a slide? There's a slide on debilitating Ds, and those are disappointment. Okay, we've talked about them prior to now. Disappointment, disillusionment, and those Ds that get you off balance, that bring fear. So you need to change your mindset. And the way to do that is to, yes, this slide, discouragement, disappointment, disillusionment, depression. So we want to change those D's. That is one of the reasons we are here today. Sorry, I'm already trying to change the slide from here, which is not possible. So you need to have a change of mindset. Face your fears. Do away with the debilitating D's. Interestingly, I was in your shoes how many years ago? Almost 40 years ago now, or 40 years ago, thereabouts. Yeah, I was in your shoes as a pharmacy student. And somehow I went through those days too. I was like, am I in the right profession? The workload in pharmacy is so much that you start wondering, why am I doing all of this? And by the time we were done with school, we graduated, and I got to the outside world and I saw what practice was like. I saw there were not as many opportunities as there are now. I was like, did I waste my time? Is this real? And a lot of fears came into my mind. So I need you to face your fears. Do away with those debilitating days. Nelson Mandela said that the brave man is not he who does not feel afraid, but he conquers that fear. Oh yes, I was scared. I was so worried. I didn't think that the future had much to offer me. Now, success is on the other side of fear. Fear cripples, fear paralyzes. So today we are going to look at how to deal with all those. If we don't, we cannot fill the gaps. The gaps are there. There are lots of opportunities in pharmacy practice. But if we continue to dwell on our fears, those terrible mindsets, then we won't be able to move. Please, can I have the next slides? My slides are now in one corner, but I hope you are seeing them. I'm seeing them anyway. Hello? I wish I could just control these things from here. Okay, so we want to look at a case study. And this case study is about a young, vibrant pharmacist who, after school, this pharmacist never worked. This pharmacist in that time was never exposed to IT and didn't have any experience of what the outside world offered. And then this young pharmacist, on graduating, went for internship and saw how practice was. There was so much restriction. The focus there was just on giving out the drugs, the products to the consumer, nothing more than that. And this pharmacist was like, is this what I went to school to do? Interestingly, this pharmacist I'm talking about had the opportunity to have studied other courses, had the opportunity to have done a course like medicine, and decided to do pharmacy just because she believed that that was her calling. And she was warned not to do pharmacy because she was told that she would just end up behind counter one day, counting tablets in envelopes and giving instruction, take 2 tablets 3 times a day, which anybody could do. That was the impression she was given there, but she felt no, that was more than what pharmacy was. She was going to do pharmacy, and she came out, and there was nothing very challenging. She also went to serve. She served in a hospital setup. There was nothing much challenging for her. It was like, is this what her life was going to be like? Then this pharmacist decided to think of how to come out of this cage where she found herself. She found herself caged. She needed to express herself. She needed to show the world what pharmacy was, because having gone through all the pharmacology, pharmacognosy, pharmaceutics, and all the manufacturing of drugs, I don't know what it's like these days. Those days would manufacture from benzene ring in the air, add hydroxy, remove meth, and come up with some beautiful products that were better imagined from our heads. So this pharmacist wanted to do something different. And that was really motivating factor. So Imagine that this pharmacist is coming to you now. Let's see the next slide. The pharmacist decided to be a community pharmacist, set up a community pharmacy, and has no funds whatsoever. So the pharmacist is coming to you with this CV. She needs a loan, or she wants you to partner with her through investment, bringing your money. And this is her CV. Qualification B Farm, Ife, married with a 1-year-old son, work experience 3 years post-graduation, including youth service, internship, business plan, none, feasibility study, none. And our vision was just a pharmacy practice that will focus on patients. Mission: to practice a pharmacy that she spent 5 years learning from seasoned lecturers at the University of Ife. Excuse me, would you invest in such a business? So naturally, there was nobody to invest in, and this pharmacist is Folasade Olufunke Lawal speaking to you today. So that was my state then, and I just wanted to do something different. I knew that there were things that I needed to do in the pharmacy space. How to go about it, I didn't know. What to do with myself, I did not know. I did not even register a company. I didn't even know that I needed to register a company. I just wanted to do something different. So, by the grace of God, my parents gave me their garage to use, thinking that over time my sanity would return and I would look for a job, because I didn't have any experience to bring to bear. And I was already married, like you saw my CV. My husband too was cheering, not because he felt I could do anything good out of it, but because he needed to encourage me, because he just had to encourage me. That was what he signed the day we took the oath for better, for worse. So that was the support that I got. And then I started without funds. Next slide. Next slide, please. So I started to climb a ladder, and by the grace of God, I was able to move from grass to grace because I was focused on what I wanted to do. I wanted to practice pharmacy, good pharmacy practice. That is what I wanted to do. So I moved from the traditional dispensing. I started to improve myself, look out for opportunities that were out there. A lot of people were telling me then that I will soon pack up because they will come in, ask for prescription drugs without prescription, and I dared to ask them for prescriptions, and they would get angry. Tell me, is this US? Is this UK? You're in Nigeria, you're asking for prescription. Where did you train? What is all this nonsense? You will soon pack up. That was the sing song around me then, but I could not be daunted at all. I was resilient. I decided that I was going to achieve what I set out to achieve. So I started to improve myself and do more than just dispensing of drugs. I learned to do pharmaceutical care. I went through a lot of training. I invested in training myself. I discovered that around me were just patent medicine dealers. And I recall one of my neighbors, a concerned neighbor, was always like, Mrs. Lawal, how would you compete with these patent medicine dealers? They have more stock than you. Go and look at what they are doing. And I told him, sorry, I'm not here to compete. I'm here to practice pharmacy, because pharmacy is a profession. And all I want to do is practice pharmacy. So I focused on why I was there. One by one, it will come. That one has left, this one has left. I didn't one day go to look at what they were doing because they were not my standard. My standard was what I was taught in school to do and what God has called me to do. So I started to improve myself. I made sure that I registered for any training that I thought would help me. And I climbed that ladder by the grace of God. We are 35 years now, and we have gone into so many things. We now do pharmaceutical care, point of care tests, medication tracking management. We are into compounding of drugs. We do health promotion. We do provision of training. We do drug information. They call us to ask for information on drugs. Other healthcare professionals do. We're involved in research. We set up a vaccination unit. We do a lot on disease prevention. We do render home services. We do online services. I'm not even sure I've captured everything that we do here. By God's grace, we service so many places from this one center. In this my one center, as I speak right now, we have, besides me, I have 6 other fully qualified pharmacists and 3 interns, apart from IT students. And we are busy working because there's a lot to be done in the pharmacy space. Next slide. So this is our care room, what it looks like. We call it our care room. You come in here, we help you to assess your risk for heart disease. We educate you on the dangers of not taking care of yourself, depending on your chronic. We generally handle patients with chronic conditions. Next slide. So I want us to move away from those debilitating Ds to the distinguished Ds. And I'll call them 3 Ds: discover, develop, deliver. You need to discover yourself, then develop yourself, and then you can deliver the stuff you are made of to your community. You need to discover your patients, develop what they need, and deliver it. You develop your interventions. We develop so many different kinds of intervention based on practice experience. Next slide. So let's start with yourself now. These distinguished Gs, apply them to yourself. Do a personal SWOT. Look at what are your strengths? What are your weaknesses? What opportunities are there around you? And what are your threats? When you have done that, prayerfully, I believe very much in prayer and God, because God helps. I believe one thing has worked for me over the years. When I set my mind to do anything under God, it works out for me. God makes a way. And I've taken a lot of risks in terms of patient care. Yes, I will just go there, and I believe that this will benefit the patient. It might cost me money to do, and then I will do it. I recall one almost, let me call a bit of a crazy thing that I did some years ago. I had this patient that had liver cancer, and it was naturally worrisome to him. A lot of people were just bringing different herbal products, different things to him to help him. And I knew that was overwhelming his liver. How could I help? What could I do? So I went online to search for a resource that would give me evidence-based information on the herbal products I was using. And then I discovered natural medicines. And to get in, I needed to pay. They told me that they gave me a bill of $2,000 something to pay. I wrote them to say, sorry, there was no way I could get that kind of money. So they brought it down to, I think, 800. Then I didn't think they had many people using the platform. I paid. I looked for that money. I paid just because I wanted to help one patient that would not pay me for that service. But I did it. And I was able to help him the much I could. Of course, we know that that's a terminal thing at the end of the day, but up to today, I use that resource to help my patients. It's evidence-based. Now it's a lot less expensive. It's not that expensive anymore. But that was the kind of thing. Those are the kind of risks that I would take without considering the cost on me. So you do a SWOT. a personal SWOT. Look at your strengths. Focus on those strengths. Don't focus on your weaknesses. If you need to do something around your weaknesses, you can contract it out. Like I have people that are doing logistics for me. I cannot do logistics. I cannot do accounting. I have outsourced my accounting. I have internal accountants. Look at your weaknesses, but don't let them make you. Don't let them define you. Let your strengths define you. Focus on your strengths. Don't focus on your weaknesses. Now develop your goals based on your strengths. When you have done a SWOT, you will see your strengths, you will look at opportunities. Develop your goals based on your strengths. Discover those people that can help you. They are called destiny helpers, so that you ride on their shoulders. And those may be people we call mentors for you. Then you deliver your best to your world by matching, or let me say you do a compounding of your strength and your opportunities. Mix them in a mortar with your pestle. By the time you mix it, you come up with a very beautiful product. And then you can deliver to the world, because there's something on the inside of you that God wants to use to help others. You have something on the inside of you. There is a potential that you have. There is a gap for you to fill. Let's go on, next slide. So to get there, you have some companions that you must necessarily hold on to, that you must have. And I call them indispensable companions. I decided to single out the first one. I matched the others together in the next slide, but this is the most important companion, and that is your God. You need God. And I saw this quote. This quote, I've come across it in so many years back, and I've always loved and admired it. It says, I said to the man who stood at the gates of the year, give me a light that I may tread safely into the unknown. And he replied, go into the darkness and put your hand into the hand of God. That shall be to you better than light and safer than a known way. This is Minnie Hoskins. So you need God. You need. Next slide. Other companions, you must be disciplined. You must embrace integrity. Your word has to be your word. You must be creative. You keep discovering things as you go. Whichever gap you are feeling, you will come across new ideas that will come up to you, and then blow them out, try them out. You must be willing to learn. I'm a learner and I love learning. As I'm speaking with you, I'm running my MBA. I'm running a training on comprehensive medication management. And I've been in practice for about 40 years, what I'm learning. You must be selfless. Put others before you. Imagine that this person that wants to use that medication while you, what would you do? Would you give that kind of medication to that person? Would you just give medication to, would you want to be given a medication without you being taught what to do with it? Would you want to be taught how to prevent yourself from getting ill? Would you want to be treated? Just be selfless. Think about others and then be resilient. All that I heard in those days, the most common thing I heard was that I would soon pack up, was that I could not make it. And I didn't have the foundation to make it really. What did I have? Nothing. I didn't have any experience to bring to bear. I had nothing. But by the grace of God, I made it. 35 years of running a community pharmacy is a success by the grace and mercies of God. What kept me on was resilience. I just made up my mind that there was no giving up. I recall those days, there was a day that my sales was 5 naira. Yeah, you might say 5 naira then. 5 naira then was still not money. And I was so discouraged, but I decided no. I was advised to close it down and go and look for a job. I said no, I was not going to close it because I knew that people needed what I was doing. because I was not just giving people drugs. I was telling them what to do with the drugs. I was protecting their interests as against mine. And that became a brand. Up to today, my patients will walk up to me and say, look, we know you don't care about our money. So it's not about our money. But you see, it's true that the doctor wanted me to take this drug. I lost the prescription. I'm sorry, they will be begging me to buy my drugs. But that came through resilience. And then you earn respect. You must be focused. Why are you a pharmacist? Why do you want to be a pharmacist? Be focused. You have a calling upon you. I always tell people that pharmacy profession is a ministry. You are going to give account to God. Even if no, you won't give account to human beings. You must be focused with what you're doing. My focus has always been to help people who are well, remain well, to prevent diseases, to promote rational use of medicines, and to optimize medication use for my patients. So that's a focus, and we have refused to let it change. And that's the culture that we have in Victory Drugs. Now, next slide. So follow fulfillment. Don't follow money. Don't follow popularity. Don't follow trends or fads. Define yourself under God and your training. Don't allow people to define you. Always ask if this decision you want to make aligns with your present goals and values. Touch other people's lives by deliberately spreading love and kindness. Anywhere I talk, I tell people I'm a community pharmacist and I am happy to be one, and I thank God that I'm one. I tell people that at the heart of every community pharmacist is care. Because if you do not care, you cannot successfully run a community pharmacy. So at the heart of pharmacists is care, because we are trained to care. So touch other people's lives by deliberately spreading that love and kindness. Next slide. My take-home points for you. God has endowed you with that ability to practice optimally. Confront your fears. Change your mindset. Surround yourself with the right companions, those indispensable eyes. Those are the right companions. People that will help you to achieve your goals. Those are the right companions. Be more community preserving than self-preserving. Let it be about the people. When you are community preserving rather than self-preserving, then you value people's lives more than the money in their pocket. Convert your challenges to opportunities. You will come across a lot of challenges in your practice setting, on your way to stardom. There will be challenges. Don't turn back because of the challenges. Look for the opportunities that are in them and optimize them. The more selfless you are, the more you make discoveries. Yes, because you care. You look at people. We are able to know those who need home care. So we go home to care for them. So the more selfless you are, the more caring you are, the more you make discoveries about people. People who need counseling on their medications, people who need, it can be as little as one day one patient came in with all the different types of drugs, and they were our drugs. And we're like, okay, ma'am, oh, she got them scattered. Okay, let's have you. She didn't have anywhere to keep the drugs. We got her a first aid box, sorted out the drugs, pill box. You are making a discovery. You are developing intervention. We've had patients that they were always forgetting to take their medications. We help them sort out in pill boxes. Those are simple things, but they go a long way. So develop interventions and deliver the interventions. My final slides. You are created to fill gaps. Tell yourself that you are created to fill gaps. There's a gap that God has called you to come and fill. and you need to feel it. Finally, I thank God for this opportunity, because without him I can't be. And much gratitude to Oluwamayowa Mudiru and members of the TCPPP. I also have a budding pharmacist, a young lady pharmacist, who approached me and decided that she would be my virtual assistant, and she's doing greatly. She's always on me to remind me about whatever I have. She will gather information here and there for me. Thank you, Pharmacist Victoria Fato. You will go places. And my distinguished audience, God bless you all.
Thank you. Wow. Thank you so much, pharmacist Folasade, even for that wonderful presentation on the gaps that needs to be filled in pharmacy practice. I think, for one, I love the fact that we were ending with the fact that I am created even to fill gaps, and I'm personalizing it because everybody on this call also needs to personalize the same, how that we are created to fill gaps. And we could remember that going through the slides, we actually talked about recognizing the gaps that each individual of us needs to fill, is actually doing a SWOT analysis of ourselves and building on our individual strength. So meaning that there is something that is actually peculiar to you that we can actually bring to the table, and we will improve pharmacy practice even in Nigeria. Wow, that's so wonderful. Thank you so much, Pharmacist Folasade, once again, for sharing your story with us, and for also sharing your wisdom and your knowledge with us, right? So I want to believe that it's also a light bulb moment for everybody else too on the call. So we're going to be having a question and answer session now. So I know that you have one or two questions from Folasade this evening, and I know that there are some specifics about the practice. Let me give you a heads up. 40 years of experience is no beans. So when your parents are saying that talk to the elders, I think the elders are on this call. So really, I think you need to wear your thinking cap, and those questions that you have in your mind. I think this is a safe space for you to hear them and then to actually ask them. So if you have a question, kindly put up your hands. I'm going to be moderating the session, while our pharmacist Folasade will be gracing us with the necessary answers to our questions. I think before I saw Uzo Vaneta. Kindly pardon me if I don't pronounce that very well. And I saw Christopher's hand up too. So Uzo Vaneta, please, you can unmute yourself and ask your question. And if you feel like you don't want to take the spot, kindly do well to ask your question in the chat box. All right, so Uzo Vaneta, you have the floor. Unmute yourself and ask your question. Hello, Uzo, if you can hear me, kindly please unmute yourself. We'll do a just do a very quick introduction of yourself, your name, your school, or if you're a graduate of pharmacy, your school, and ask your question. Uzo, please, we're waiting for you. You can ask your question. Okay, I think that's a mistake. All right, Christopher, if you are with us, I saw your hands up. You may want to ask your question now.
Okay, thank you very much, Ademola. So my question is that what
Right.
is
So
actually,
please,
can
hello,
you hear me
Chris.
now?
Please do a quick introduction of yourself, right?
Okay, thank
Before the
you. I'm
question.
Christopher. I'm Christopher Aleji. I'm a 400 level pharmacy student from Obafemi Awolowo University, Ilefe, Osun State. So my question is that what's actually different in pharmacy practice when we talk about urban and rural areas in Nigeria? What are the limitations, and how exactly, if we're starting out as pharmacists, getting out of school, getting your B Pharm after interning, how are we to like see what the world holds based on the urban and rural setting? How exactly can we thrive to actually be a good practicing pharmacist, other than just a pharmacist that is done and is just trying to like get into the space? So what are the limitations that comes with urban and rural setting of pharmacy practice?
Thank you. That's a very interesting question. And it's one of the things dear to my heart because we have many more pharmacists in the urban than in the rural areas. And the rural areas need us because there's no vacuum in nature. Something would occupy it. So the rural areas are generally dominated by non-trained healthcare professionals. Naturally, the rural areas are not as interesting or inviting for obvious reasons. There are less infrastructures, you get cut away from people and all that. But you see, like we have said, first of all, look at your own areas of strengths. Can you plug into the rural community and make a difference? And when you go in there, now I know that now government is encouraging people to go there, and there are soft loans for as many people as want to go into the rural areas. I know that there's opportunity for support. And thank God for technology. You can do a lot. You can manage many rural areas with technology. I also know about satellite pharmacy that is in the offing. I don't know how far we've gone with it, but I attended a workshop some time ago on satellite pharmacy where we could set up satellite pharmacies. So what you need to do is look at yourself. Do you have a calling towards the rural area? If you do, how can you fit in? What can you reasonably do within the rural sector without compromising professionalism? And there's a lot, especially now that we have task shifting. You can have people man the various trained. You can have work with technicians. You can man some rural areas and deliver pharmaceutical services to them. So there's a lot that can be done. It's just that we need to think through and we need to be ready to disrupt the system positively. What you need to do is just start on a small note and start focusing on the opportunities that will come, because they will come. I don't know if I've in any way answered your question, but directly, the rural area is less lucrative seemingly than the urban areas, but the urban areas are generally dominated by pharmacies, and you may just find that going to the rural area will also enhance your practice, especially if you have a strength there, if you have a calling there, because that's what may helps you to endure. When you have a passion for something, it keeps you going. So if you have a calling there, start and seek help. You will get it.
Thank you very much, Ma. And my second question is that, sorry, can I go on, Ademola?
Yeah, please go ahead.
Okay. So my second question is that how exactly is technology changing the landscape of pharmacy practice in Nigeria? Now we've known about the virtual pharmacy practice, telepharmacy. So which area of pharmacy practice can we categorize telepharmacy? And so to say, is there a kind of not too sided way of how technology can help one aspect of pharmacy practice than other. You've shared different aspects of pharmacy practice. So how exactly is telepharmacy coming into space? And is there a kind of not too balanced thing in different areas of pharmacy with technology?
Okay, like we know, technology drives efficiency generally. So that is one plus there. And then you can achieve, which is also the efficiency, a lot more. For example, now you can do virtual consultation reasonably. The only thing is that we are yet to have defined policies around them in Nigeria. But I know that in some other countries, they're doing a lot with technology in healthcare. So you can have virtual consultation. For example, you find yourself in the rural area and there are some conditions that probably would need diagnosis. You can, through technology, consult with other healthcare professionals, doctors, and then they might be able to solve that problem in your pharmacy without the patient even getting to the hospital. And if it's a case that must go to the hospital, they will assess and tell you this case must go to the hospital. Let me give an instance. Some years ago, Omron decided to improve pharmacy care. And I was part of that pilot study that they did. So what they did, they empowered us with some tablets, communication tablets, that we could use to communicate with consultants at Luz, because it was a Lagos-based thing. So because it was a pilot, we went out there to screen people who did not even know they were hypertensive. And we brought them into the program, as many as their blood pressures were rather high. Then the consultants came into our pharmacy to assess them. And those who didn't have complications, who just needed to have their BP managed, were registered on the tablets which were given. So they were placed on medications. And then they were to see us monthly. We measured their pressure and reported to the consultants, who would review, either say continue medication, change medication, whatever as the case was. Because we know that in Nigeria generally, patients hardly go back until they develop complications. Once they start them on medications, they continue on it forever unless something happens. So those patients now had opportunity to access better care through the tablets. So the tablets was a communication gadget, was bridge the gap between them and the hospital. So they didn't need to go to see the doctor throughout the 6 months. They would come to the pharmacy, we took their vitals, sent it back. Even when we had cases of angioedema, we were able to manage from our table there. So that's an example of what technology can do. And of course, lots more. Now you can do electronic management of your patients. Patients can upload prescription as long as they are not drugs of addiction that you must, have the hard copy and all that. There's so many things you can do with technology. But like I said, we still don't have very clear-cut policies yet. But we have to start from somewhere and develop these policies as we go. As long as we focus on do no harm, our focus is on helping the patients to access care and get better. We must not lose sight of that. I don't know if I've spoken to your question.
Right. Yeah, thank you very much, Ma. Christopher, does that answer your question?
Yes, it did. Thank you very much, Ma.
All right, that's wonderful. All right, thank you very much. So we have some questions already in the chat box. So if you want to ask a question, kindly keep it short and direct, but still maintain your self-introduction and your school before you ask your question. So Bisola Shonoiki Shonoiki, please, you can unmute yourself and ask your question. My apologies if I don't pronounce that well.
That's okay. Can you hear me all right?
Yeah, very well.
Okay, thank you. Good evening. Unfortunately, I didn't listen from the beginning. I didn't realize the time difference. So I'm a qualified pharmacist, and it's been great listening in as well in terms of pharmacy practices, so just learning from you guys. My question, please, or rather an observation, is about data gathering. So you mentioned technology being utilized in the right way to help patient care. I do wonder what all the gaps there might be, because you know, I don't know what kind of data is being collected. So you mentioned about this home run pilot and what data was captured from that to then send back for as a conclusion, if you like, of that particular pilot. And then the other thing is about, you mentioned that you had to send the information to the consultant. It seemed as if there's a missing link or a missing opportunity for pharmacists to be empowered to treat. Now, I don't necessarily understand the care model very well, but it's especially something like hypertension, you know, that waiting for a consultant to then prescribe or recommend the next thing to do. Is that an opportunity, or do you see that as an opportunity going forward for something that is very predominant in the system, such as hypertension? I hope that is clear.
Yes, it is. Thank you. I'm glad you brought that up. We're not yet there in Nigeria, but we will get there. And it starts with data gathering like this. So we can make a case. I know that I was in the UK 2015 for Commonwealth Fellowship, and I was exposed to, that was when I came across prescriber pharmacists for the first time. So they trained pharmacists there. They did 6 months training for them to be prescribers. We don't have that yet in Nigeria. And that's why we cannot yet prescribe for those hypertensive patients. And I don't still, because we're not covered. We don't have the cover yet. But we will get there. The more of us are involved in this care, and with data gathering, right? You see, now we have more collaborations than we used to have. Formerly too, you know, pharmacists in Nigeria were not allowed to vaccinate. Now they are vaccinating. So it's little by little that we will get there. By the time we see the gaps, then policies will come up to fill the gaps. But we have to prove that there are gaps. We have to prove that there are things that we can do. And there will be trainings to enable us to it. I like that there's now what we call task shifting. And those policies are being reviewed from time to time. Task shifting means that they are delegating some tasks down the line, from probably doctors to pharmacists, pharmacists to nurses and all that. So I'm not quite clear on it yet, but I know that there are delegations now. So what we need first of all is to even be available for it, to prove that we can do it. And it starts with the data gathering. That's why data is king, data is power, and that's where technology comes in. So we're able to gather data. For example, that exercise we did showed that patients trusted their pharmacists more, because the idea was they wanted to bring in new patients, and it was difficult. They could not recruit patients easily within the community except through the community pharmacists. So that's a strength there. And over time, we'll be able to surmount whatever challenges or obstacles there are. All we need to do is to prove that we have the stuff. This is what we can do. We're not just selling drugs. We're not traders. We're professionals in our rights. And when we prove that that is what we are, we'll receive the necessary training. We'll be empowered to do more for our people. We're not yet there, but we will get there.
Yeah, that's progression right there, and we can always be sure that things will get better as regards pharmacy practice in Nigeria. Bisola, I believe that satisfies you because I can see your reaction. All right. Okay, all right, no problem. So I think we'll just go over the questions in the comment section. Mulero, I saw your hands up the other time, but let's just tackle the questions in the comment section now. So I'm reading from for Audrey Johnson. She says, or he or she says, I think it's a he. It says, hello, I'm in the US and focused on minority health. Are there any groups or need for expertise to assist with development?
I didn't get that question.
I equally okay, Audrey. If you can hear us, you can kindly rephrase your question so that it can be a little bit clearer. You said, are there any groups or need for expertise to assist with development? What development? Do you mean the development of minority health? Okay, while we wait for Audrey to rephrase his question. All right, so from Victor Walishe, he says, hello, I'm Victor from Nnamdi Azikwe University. I would plead for Folasade to shed more light on data as a field in pharmacy practice.
Okay. Well, I know that there are some pharmacists that focus on just gathering data. At least I've come across one, and all she does is just to gather data. So, like I said, we are going more into technology. We are doing more of electronic capturing of patients, and we're doing more of electronic care management, documenting. So there are some pharmacists that, well, they are still linked with researches, but they just go there, gather data to be able to inform policies, influence policies, inform decisions. I can't remember a particular company now. I don't know why I'm not remembering that day, but that's what they do. They spend some time in the pharmacies to gather data. So I don't know if that answers your question.
Yeah. Thank you very much, Ma. And hi for one. I want to believe that every one of us too. I mean, we're students of pharmacy in that sense, and we know that data is also a key. I mean, instrument in research. And when we talk about development, definitely research is also another part that we need to focus on. The data on ground is actually what gives the idea, of what we need to do going forward. So thank you very much from Falashade too for that. So Victor, I believe that answers your question. All right, from Faidat Kamaruddin, he says, thank you, Ma, for she says, thank you, Ma, for the wonderful presentation. I'm Kamaruddin, a fresh graduate from Usmanu Danfodio University, Sokoto. How can one source for professional trainings to embark on that we aid the practice as a fresh pharmacy graduate? And also, what platform would you recommend for such trainings?
If I got you right, I think that would depend on your area of interest in pharmacy practice. For example, if your interest is in community pharmacy, then what you need is to look out for reputable places where the practice is top notch for your probably internship or youth service, as the case may be. And if you enjoy the experience there, if it tallies with your goals and vision, then you can spend some more time there. And through that, you will realize the gaps that you need to fill. You can go for some courses online. You might go for some physical courses. And then if you are able to get a mentor, you'll be directed, because it's just like patient care is individualized. So are these things individualized. So I cannot say this is where you go for what, unless I know what is on your mind to do. So there's no general thing like that. For example, recently I decided that I needed to do more to develop more on my collaboration with other care professionals. So I took a training, I took an online course. It's from American College of Clinical Pharmacists on comprehensive medication management. And it was really enlightening to me. So I did that course. I did the first leg, and then I registered again for the broader one. Of course, we're not yet doing comprehensive medication management like that in our country, but we'll get there. And I'm preparing myself for when we get there. So it depends really on what you want. But you might need a mentor because you're fresh from school. I can talk more on community pharmacy because that's where I've done my 36 years now, because I did my internship in community pharmacy. I don't know if that answers you. Well, please, you can always reach out to me outside of this evening. You can give you my number.
Yes. Yeah, that's wonderful. So far that I want to believe that that's a open check for you. So, and I want to believe that that answers your question. All right. So, from
so much.
Yeah, all right. From Philip Onyedikachi, he says that okay, all right. So thank you very much for your contribution, Philip. So all right, so we have question from Afsa Saleh. He says a 400 level pharmacy student of KSU. He says that how do we know which field of pharmacy to specialize in after school?
That's $1 million question.
Yes,
like
ma'am.
when I was out of school, initially, I didn't know what to do with myself, really. When I was in school, I loved academics and I wanted to go after academics. But I went through a lot of rigorous schooling, and for the first time in my entire life, I failed. So I had to repeat a whole year, and then I got pissed off academics. I told myself that, no, academics was not for me. Let me just graduate and go out of here and find something else to do with myself. So that was my mindset. So when I finished, I knew that we could do internship either in the hospital or community. I knew that then you could not do your NYSC in a community pharmacy. They would not allow you. We're only allowed to do NYSC in government hospitals because they needed the pharmacist there. So I decided to do my internship in a community pharmacy to get the experience, to look at what it was, because we didn't have opportunity for IT like you do now. So that was where I fell in love with community pharmacy practice. And I started seeing potentials that I could bring to bear there. I did a year in the hospital, but there was a lot of bureaucracy that would not allow me to express myself. I was being pressed down more or less because I had to comply with directives that probably were not necessarily aligning with my vision. And then after that, I did another 1 year in a private hospital, and I did not enjoy that exposure either. So I decided that community pharmacist was it because it would allow me to influence things within the ambits of the law. There's a difference between this. So you could influence things within the ambits of the law, or despite the law, if you have people that would not allow you to do what is the right thing to do, that might be an issue. So those were my own motivations. Those were the things that made me decide to own a community pharmacy that early. I just wanted to be on top of things. I wanted to be able to take those decisions, the decision not to give out medications that needed prescription without prescription. I didn't want to be under pressure to do anything contrary. So even when I started and a few people were interested in it and wanted to partner, invest their money, I told myself that who pays the piper will dictate the tune, and I didn't want to be under pressure. I said that because I need you to have an open mind so that you can now look at, if you are not sure where you want to be, like I said, do like a SWOT. Where are your strengths? Where can your strength fit into? Do you love talking a lot, researching? Do you like studying, imparting knowledge? If you know those are the things that you like, you might try academics and see if it works for you. There's nothing wrong in you start something, you find out it's not working, and you try something else. It's just that it should be reasonably done. Thank you.
All right. Yeah. I want to believe that. Thank you very much. I want to believe that that answers your question. And if you were here on the call, Farm Folasade actually took us through that part, when she was talking about doing a SWOT analysis of yourself and focusing on your strengths. So, if you are able to identify those things, knowing where you fit, even in the pharmacy practice, should not be something very difficult. Yeah, thank you so much once again, Farm Folasade, for that wonderful reminder. All right, so Elisha is asking a question, even though I would have loved that you guys actually, unmute yourself and speak with us. All right, Elisha Remu is a 300 level student from David Umahi Federal University of Health Sciences. He said, I was not active from the beginning of presentation, so I don't know if it was spoken about, but the question goes thus: how do I choose someone to be my mentor in the pharmacy field? Right.
Awesome. It's still about your SWOT, and your goals. Where do you want to be? What are your values? Because whoever is going to mentor you should be somebody that aligns with those goals, somebody that has gone ahead of you where you want to see yourself, that can lift you up to that level. So that is how to choose a mentor. You look out for somebody that is occupying where you would love to be, and then let the person help you to get there. Thank you.
Right. All right. Thank you very much, ma'am. So Ibrahim Hussein is a graduate of industrial chemistry, but he currently works as an assistant pharmacist, or maybe a pharmacy assistant, he meant. So he said, I was advised to go for a second degree in pharmacy. What will you advise, ma'am? Mind you, Bisola, Philip, and Mulero, I can see your hands up. We'll attend to you now.
On a lighter note, if I had my way, everybody would be a pharmacist. So please go and I love pharmacy a lot. So go and do pharmacy because it empowers you. Pharmacy brings out the best in you, honestly. Pharmacy trains you. With pharmacy, you see life in a broader perspective. So your being a pharmacy assistant limits you. You cannot own a community pharmacy in Nigeria if you're a pharmacy assistant and you're not a pharmacist. So if you love pharmacy, please go ahead and do pharmacy.
Yeah.
Mind you, note something. Let me just say this. Sometimes you look at the number of years, 5 years, 4 years, but they will come. Those years will still come, whether you do it or not. So why don't you spend those years doing what you are passionate about?
Oh, that's very wonderful, ma. Thank you very much. I can't help, but also think about, yes, pharmacy is very beautiful, right? But being a part 5 pharmacy student, right? So it's all good. So Ibrahim, please, you want to take on that advice, right? I was on a conversation this morning also, and I thought to share, and there was this there's this my life coach is going to her 60s, and yet she's in the university. I mean, going for a master's degree. She has achieved almost everything that you would say that an average human being should achieve. But this is her still going to school, right, in the US for a master's degree. And, she will always say something to me that I find fulfillment in academics. And she says that before I breathe my last breath, I would make sure that I give it all it takes. And imagine having a 60-year-old person as classmate. So meaning the time doesn't matter. What matters is actually the fulfillment. So I think also that you want to give it an expression. Ibrahim is asking you, Ma, that which school to be precise.
Okay, Ibrahim, before I answer that, I'm 61 and I'm in school. I went back to do my master's 18 years after first degree. And I think then I was the eldest in that class, but I enjoyed it. I loved it. Some people were like, what are you going back to do? I said, don't worry. But it made me better. I saw life in a much more, it's improved my practice a lot. So please don't let any age limit you. Well, as per choice of school, I think it depends really on you now. You may find out about the different schools, and then you'll be able to pick the one that you will love to be in. I don't want to bias you. I went to Great Ife. Great Ife. That's where I went. So you may join us there if you want.
Okay, all right, that's very wonderful. All right, so Ibrahim, we're glad to have you on this call, and we consider you one of us in no time, right? So thank you so much, and I believe that it's been a light bulb moment for you, right? So all right, so I think we have some persons that their hands have been raised. So let's just go through with Mulero Mayowa. You can unmute yourself. That's our student representative at TCPPP.
All right. Good evening, Demola. Good evening, Ma, and good evening to everyone on the call. So, my question is for a fresh graduate of pharmacy that just graduated from pharmacy and then wants to go into the community setting, but then as a fresh graduate having little or no leverage, but then you know that what you want to do is that you want to have your own community pharmacy. What advice, Ma, can you give to such an individual? Okay, as a starting point, where to start from, and then how you can build on where you are starting from till you get to that height that you really want. I know you've talked about it briefly during your presentation, but I would really love it if you can please elaborate more and probably use your own personal experiences too, Ma. Thank you very much.
Okay, thank you. It looks like I cannot overflog this. So, okay, you just finished from school and you have a passion for community pharmacy. Identify a good community pharmacy and do your internship there. Don't mind what you are paid. See yourself as paying out to get what you want to get, because sometimes the community pharmacies don't pay so much to interns, and I won't blame them. You have to be under a pharmacist. They will pay you a pharmacist. You have to learn under a pharmacist. It's not like a government facility where they can pay you any amount of money. So just make sure that you avail yourself the opportunity to learn. I've had people come to me to say, we just want to learn so that we can set up our own. That's fine. We'll take them and expose them to learnings and give them opportunities to learn.
All right. Yeah. Thank you very much, Maiwa. I believe that combining that with what you heard during the presentation, I mean, forms a complete hole in your heart. Yeah. Okay. So Bisola
Sure, thank you.
Shona, I have a feeling that this name is Shonaike. So Bisola.
Shonoiki.
Oh, Shonaike. Okay. All right. Please go ahead.
Thank you very much. So my question, please, to our lead pharmacist here today is, listening in, there's a lot of gaps to fill. It is not peculiar to Nigeria. It is all over the world, in varying degrees. My question specifically to do with Nigeria is, knowing that there's this gaps to fill, where do you think the priorities ought to be in pharmacy practice? What, in your opinion, having practiced for so long, where do you think the priorities ought to be to start off, to move things forward for everyone to gain?
Okay, I'm not sure I fully grasp your question, but what I'm decoding, from what I'm decoding, I think we need more people in regulation, in policies that will advance the profession, that will give more room to practice.
Okay.
So we need a better practice environment. So if we can have more representations there, that would be good. And then, like, I'm very passionate about community pharmacy. I think that is the mirror of pharmacy, and that is where we can reach more people. So I will also give that some level of priority. But I think the top, if I'm listing them, I think regulation in terms of those who are able to influence things. But for a fresh graduate, you might not be able to influence things in at that level. So you may just want to come in to grow. Once you get to that level, lift where that's where your area of passion is. But for us to get a better practice in Nigeria, I think that we need more representation at the policies domain, those who are making policies that will influence the practice positively, so that we can do many more things and be protected by law to do them. Because we have a lot to offer.
All right. Okay. Yeah. Thank you so much, man. And I think that has to do more with, I mean, giving priority to the part that giving priority to, the part that enables for the further practice of pharmacy, right, in Nigeria. That's wonderful. And I believe that I'm also a participant on this call. So I have a question too. For one, I always consider community pharmacy as a retirement plan for me. I don't know why, but then for some reasons, I have some, should I say, years of experience looking at the education system in Nigeria that's allowed for, some years out of school, right? So, in the community pharmacy settings. And for me, I see that community pharmacy is actually a pool that is saturated already. And maybe that's why, subtly in my mind, I already consider it a retirement plan, something that when I'm done exploring other hands, I can now come back to maybe to just to come and, flex my muscle in the community. But I think my perspective is changing ever since I actually started the clinical courses. And I think my perspective is changing and I'm learning and I'm beginning to love it more. I just want to ask, as a pharmacist with over 4 decades of experience in the community pharmacy, are there some novel things that you actually think that maybe persons are not paying attention to now that can actually, that persons on this call can, look into incorporating, and it will make them to be leaders even in that particular discipline of pharmacy? Or are there directions that you think that as students we can begin to look into, and that is going to catapult us to industry leaders when we eventually get to start our own?
Thank you. I'm glad that you said you're already changing your perspective. Community pharmacy is not for retired people. It's not for people who are tired. They say that's where the influence of the patient is. Community pharmacy, and in community pharmacy, you must be a jack of all trade, a master of all. That's what community pharmacy is about. 2014, I went to Ghana to do a training on drug information services. And I recall one of the things I was like, yeah, community pharmacy, what's your business with coming to do a course on drug information? I just smiled on the inside of me because they don't understand the power that is in the community pharmacists. We are the first port of call. We can make or mar the patient. We need all the knowledge acumen that we need to help the patient to direct appropriately. And we've seen so many cases. Let me tell you, recently, there was this patient that came in and he had a prescription for antibiotics and whatever. When he sat down and I looked at him, he had swollen feet. He had dyspnea at night. He had high blood pressure. My head thought differently. And I said, sir, I think you need a cardiologist. He tried to argue with me. Eventually he went and he was diagnosed to have a heart failure. That is community pharmacy for you. We do a lot of interventions. We just must have a lot in here. And you keep learning and learning and learning because you must learn. So it's not for retirement age. No. If you want to be a community pharmacist, come on board early so that you can make a difference. Because there's always something new somewhere that you need to know to help the patient optimize care. So community pharmacy is a lot. Please remember that as a community pharmacist, you're a jack of all trades and master of all. You must be vast in your oncology knowledge to an extent. You must, because they will come to you. So you must be able to suspect cases. Oh, yes. We've seen so many cases. We've had cases that after referral, I've had a case not too long ago that by the time I saw that blood picture, the patient did a blood work. I didn't even cite the patient. They just sent that message to me from the pharmacy. I said, look, to the teaching hospital straight. And that patient was admitted and diagnosed to have leukemia. Meanwhile, they were already patching up somewhere, putting the patient on period level and things like this. So the community pharmacy, we are the red alert. I mean, we speak red alerts. Do you understand? There's a lot of work. We must be able to look at things very precisely to say, okay, this is not a case that can be managed in the pharmacy. This is where you should go. Because if you don't even refer appropriately, you might the person you refer to might be the one that will mess up the patient for you. So there's a lot of work in community pharmacy. Please don't wait for, if you want to be a community pharmacist, a successful one, don't wait for retirement. When you are retired, you cannot, you don't have much to offer anymore. So start now.
All right. So that changes my perspective further. Yeah, thank you so much, Folasade. And I mean, for if you have a question, please, I think since there are no questions, I believe that we are already at the tail end of this. So you don't want to miss this Kairos moment to actually ask your questions, right? So, but I mean, just part of the closing words. I want to believe that everybody on this call, except for some selected few that indicated that they are graduates in that sense, I want to believe that everyone on this call has students, right? And many in their 300 levels, 200 levels, 400 level, 500 level, and 600 level, and what have you. And pharmacy practice in Nigeria, what gap is left to be filled? And I believe that there is still a gap that students of pharmacy can actually fill. So basically, I just want you to share more light into the gaps that as students we can, or the things that we can do as students to actually contribute to the progression of pharmacy practice in Nigeria. So basically, so that being students also will not be looking into it that, oh, it is until I become a pharmacist before I can contribute to the pool of, the available professionals that are out there, improving the life and outcomes of patients. So what can we as students start, doing that we can use to fill some gaps and contribute to the improvement of pharmacy practice in Nigeria?
That's one of the best questions that have been asked here today. Also, interestingly, when I was taking my training on CMM, I found out that many of the pharmacists, they are used students. For part of the researches that they did to get feedbacks from patients, to be able to make cases for implementation of certain policies. So students are very, very valuable, and there are lots of gaps that you can fill. Luckily now you are allowed to do IT trainings. You may even do independent ones. You don't have to wait until your school does. Just attach yourself to a good community pharmacy where you'll be given the opportunity to express yourself. You have a lot to bring to the table. You can help with data management. You can help with clerking of patients under supervision. You can manage online information once you are trained on what to do and you're under supervision, especially when it comes to the research work within the pharmacy. You can be trained to do quite a number of things, get feedbacks from patients. You can also participate reasonably in patient care. You can, like in Vitridus, we have online groups. Okay, I had this student. Yes, I had this student. Now she's doing a master's in the US. When she was still a student, before her first degree, she was part of our online groups. And what she was contributing was every time, every Sunday, when we usually will have lectures on Sundays, lecturer will come. She will collate all the lectures and then transcribe our story somewhere so that one day we can make a book from it. That's something that she was doing that was very valuable to us. So she was remotely contributing from school. So there are so many things that you can do. Well, that question caught me unawares. So that's why I cannot say as much as I would have said. But there are lots that you can do as students. We have students coming like that. And as long as we expose them to areas that the law permits, then we are good to go.
Wow, that's very profound. Thank you very much. So, meaning that sends a message to everybody on this call that you can actually start from where you are at the moment, right? So, the best time to actually start filling the gap is now, right? So, don't wait until so many years to come when you now start. Oh, yeah, let me fill a gap, let me fill a gap. So meaning there's a joint that you can actually contribute, right? So if you look at the whole organogram of pharmacy practice in Nigeria, you have a place there, right? You are an undergraduate pharmacy student in that sense, and there is a joint that you can actually supply. And in the PCN structure as finalists in pharmacy practice, in pharmacy profession, in the university, you are called affiliate pharmacists, right? So meaning you are recognized. So meaning there's a part, right, for you to play, right, when it comes to the development of pharmacy practice in Nigeria. So I believe that it's been an awesome going to 2 hours of conversation with Folasade. And for me, it has been so enlightening, right? And I want to believe that for everybody on this call too, it has been the same. I can understand the attention span of persons, how that some persons that joined us from the beginning are no longer here with us, but then we also appreciate you that actually joined along the line, and we recognize your presence, right? So I think this is the juncture where I actually thank Folasade Olufunke Lawal. Thank you so much, Ma, for being with us here tonight. And we understand that with your busy schedules, you have the best interest of students at heart, right? This will be my second time being under your voice. The first time I was just part of the congregation, right? So, but it's an honor to moderate this session with you, Ma. And thank you for all you do for pharmacy practice in Nigeria. Thank you for all you do with Victory Drugs, right? And we also believe that the impact that you've placed on each and every one of us will be so lasting. And in no time, we'll be taking up the banner also, doing many amazing things, even in pharmacy practice in Nigeria. Thank you so much, Ma. We appreciate you. And if you can hear my voice, you can send your reaction, to celebrate Pharmacist Folasade Olufunke Lawal. So do well to do that. Come on, shower those encomiums, shower those encomiums. Yeah, thank you so much, Ma. If you can say something from the comment section, you can say wonderful things about her. All right, thank you so much. And to every of our participants, we appreciate you. For the ones that actually joined from diaspora, yeah, we see you and we recognize you, we celebrate you so much. Thank you for your contribution so far. And I think I need to state that the student representative dropped a link. If you want to join the army of compassionate pharmacists, right? Across board, right? There's a group for us, right? So where we can actually join to see what we can do to improve pharmacy practice in Nigeria and in diaspora. So the link is actually in the chat box. So do well to click on it and do well to join. And if you also want to connect with our speaker on LinkedIn, you want to connect with Folasade. I don't believe that Kamaruddin, right? I think that was Fidat that got the offer, right, to reach out to Farm. Right, so basically you can connect with Farm on LinkedIn and every other social media platform. You can also follow and connect with the Compassionate Pharmacy Practice Project, even on LinkedIn also and on Twitter. Right, don't worry, you will soon see us everywhere on your phone. Right, so thank you so much for joining tonight once again. So I just want to ask, does Farm Folasade have any closing words, any closing remarks, even to everybody on this call?
Don't forget that you are created to fill a gap. Thank you.
Thank you very much, Ma. So how I wish that this is more or less like a class settings. We could have just chorused it together, but let me have faith that you chorus it together with me. So just say, I'm created to fill a gap wherever you are. 1, 2, go. I'm created to fill a gap. All right. Yeah, thank you very, very much for that, fam. We really, really do appreciate you, and many of the appreciations too in the comment section. Yes, the recording would be available and most likely on the YouTube channel for either Sam Life or the Compassionate Pharmacy Practice Project. So be on the lookout. If you join a army of compassionate pharmacists, you be sure to actually get the link when it is actually posted already. So thank you once again. My name is Bakene Ademola, and I'm a Part 5 pharmacy student from Obafemi Awolowo University. Thank you so much for having me also as the moderator tonight. And once again, I recognize all of the team members of TCPPOAU, Mulero Mayowa as the student representative, Christopher Haleji as the student representative. Also, I can see Stella Olubo as our director of content, right? Okoyemi also are part of us also in OAU, right? So do well to join the army, and it's been an awesome time together. Thank you so much. Do well to actually do something from where you are, right? That is actually the plan, so that things can get better. Thank you so much.
Thank you. Bye.
Bye, everyone.